Hello, I'm Dr. Pallavi Vasal, consultant obstetrics and gynecology. Today I'll be talking about abnormal uterine bleeding. So abnormal uterine bleeding is bleeding anywhere from the genital tract, which is unusual. It can occur as in the form of spotting or bleeding before the periods or in between periods, after sex, or it can be longer than the normal periods, heavier than normal, or if the bleeding is happening after menopause. The causes, if we divide the causes of abnormal uterine bleeding, if we see in young girls who haven't started with their menstrual periods, it's usually because of trauma, any foreign body irritation of the genital tract, or any urinary tract infection. But we have to be very careful about the sexual abuse in young girls if it is happening. In adolescents, during the teen age, it can be during the first few years of the after attaining the menstrual cycles. It can happen in the first few years. This is because of the hormonal changes which are happening in a girl's body. But in that case also, we need to rule out any kind of pregnancy, infection, any bleeding disorders, or any other medical illness. In the reproductive age group, pregnancy has to be ruled out first, because that is the most common cause of abnormal bleeding in the reproductive age group. Then it can be because of abnormal gain in weight or sudden loss in weight, intake of any hormones, or in use of any contraceptive, intrauterine contraceptive devices. In premenopause, that is between the age of 40 to 50 years of age, it can be because of the ovulatory dysfunction. That means there are changes in the hormones when the periods are about to end. Because of that, the hormones they are dysregulated. That leads to abnormal bleeding. It can be because of the fibroid in the womb, or it can be because of the increase in the thickness of the lining of the womb, or a growth of an endometrial polyp. So pregnancy, precancers of the cancers of the cervix, or any kind of cancers, this also needs to be taken care of. And in the postmenopausal, this is very important to see if a lady has started bleeding again after attaining the menopause. This needs to be, because we need to rule out cancers which are very scary, and if it is diagnosed at a very early stage, it can be treated very nicely. Another most common cause in menopausal age group is atrophy. There is thinning of the lining of the vagina and the womb. Sometimes that leads to irregular bleeding, or growth of a polyp or a fibroid, or infection in the uterus. That can also lead to abnormal bleeding in women who are menopause. Now the symptoms, as we discussed, the symptoms are like bleeding or spotting in between the periods. The periods are less than 26 days or more than 35 days. Heavy bleeding or prolonged bleeding during the periods. Now, as we go ahead, you need to go to a gynecologist, get a general checkup done along with the abdominal examination and the internal examination. And then usually ultrasound is very much required in these cases to rule out anything which can be treated by surgery, or the treatment can be with the medicines. Now, a couple of blood tests like CBC, the complete blood count, the hormonal profiles, the infection screen, the pregnancy test, all these needs to be done. Now, the treatment is based on the cause. If it is like there is no significant pathology identified, then hormonal correction is required, and this is done with hormone therapy, which can be oral, injectable, or in the form of intrauterine contraceptive devices. Or if there is a particular cause like fibroid or polyp, then that needs to be removed through the surgery. In menopause age group, we advise endometrial biopsy, even if there is nothing much significant in the ultrasound, because we need to rule out cancers in patients who have attained menopause but still are having periods. So the important thing I would say is to the young girls especially, avoid taking excess of hormones, and you should maintain a very healthy weight and healthy lifestyle. And there is very high intake of eye pills in adolescents. That should be avoided, because it also that screws up your period and leads to irregular bleeding. For any further queries, you can talk to me or connect me through Lybrate.